Hey everybody, welcome back to Pediatric Therapy Essentials. My name is Dr. Heather Sossaman and I'm a pediatric physical therapist. Well, in this week's episode, we're going to be talking about Down syndrome, so stick around. Hey guys, and welcome back. Well, as I said, in this week's video, we're going to be talking about Down syndrome. Now, Down syndrome is a genetic condition that affects roughly 6,000 babies born in the United States every year. And to understand a condition that's rooted in our genetic makeup, we have to understand a little bit about human genetics. The human body is made up of cells, and we have all different kinds of cells. We have skin cells, heart cells, lung cells. And within each of those cells is a special area called the nucleus. And the nucleus is important because it contains our genetic material. And when I say genetic material, I'm referring to our chromosomes and DNA. And if you remember back to high school biology, DNA is our deoxyribonucleic acid. And it is this long chain of genetic code that makes each and every one of us individual. Now, this genetic code is really long, so our body compacts it and packages it up into these smaller units called chromosomes. Now, each human has 23 pairs of chromosomes. We get one pair from mom and one pair from dad. Now, in the case of Down syndrome, there's an extra copy of chromosome 21. So that means either mom or dad gave 2 copies of chromosome 21 instead of just one. And that's why you may hear Down syndrome referred to as trisomy 21. Tri meaning 3. So individuals with Down syndrome have 3 copies of chromosome 21. Now, there's 3 different ways that this can happen in individuals. The most common and the one that accounts for about 95% of cases of children with Down syndrome is trisomy 21, in that they received a complete extra copy of chromosome 21. However, there are 2 more rare types of this condition. The first is translocation. So that means a child received a part or whole extra copy of chromosome 21, but instead of it being a standalone chromosome, it's attached to another chromosome. Another rare form is Mosaic Down syndrome. And in this condition, not every cell in the human body has that extra copy of chromosome 21. Some cells have it and some cells don't. Now, because individuals with Down syndrome have this extra copy of chromosome 21, it does impact their growth and development. And I'm going to review with you guys some physical features and medical conditions that are common to individuals with Down syndrome. However, I want to be clear that these do not apply to every individual with Down syndrome. We are all unique individuals as humans, and so none of us are exactly the same, except for identical twins. So there are some physical characteristics that are common to individuals with Down syndrome, and physical characteristics means things that you see on the outside. So many individuals with Down syndrome have more of a flattened face, especially across their nose. They have more almond-shaped eyes. They have smaller hands and feet and tend to be a little bit smaller in stature in general, which means height and size. And many of them have a crease across their palm called the palmar crease. In addition to physical characteristics, there are some medical conditions that tend to be more common in individuals with Down syndrome. And these conditions are something that your doctor would monitor. So many kids with Down syndrome have congenital heart defects. So conditions such as atrioventricular septal defect, patent ductus arteriosus, and tetralogy of Fallot are common conditions. Some of these conditions do require surgery shortly after birth or in the first few years of life for kids with Down syndrome. But many of them may be able to be managed without surgery. That would be up to your physician. Another condition that may occur is Atlanto-Axial Instability. And this means that there's a little bit of extra movement between the first and second vertebra in our necks. Now, the vertebrae are incredibly important because they protect our spinal cord, so we don't want any extra movement there. Kids with Down syndrome can have some extra movement there. But over the past 25 years, there's been a lot of discussion and differing opinions on how to manage or detect this condition. And the most recent information that I could find was published in 2013 by the American Academy of Pediatrics, and I will leave a link to it in the description box below. But their general recommendation was there's no need for x-rays or MRIs unless a noticeable change has occurred in how a child moves their hands, walks, or their bowel and bladder function. And those things would indicate that something's going on with the spinal cord. There can also be issues with vision or hearing in children with Down syndrome, as well as gastrointestinal issues and decreased muscle tone. So as a PT, what is my role in helping children with Down syndrome? Well, as I said, kiddos with Down syndrome often have low muscle tone. And I did an entire video about muscle tone, which I will link up above if you'd like to check it out. But muscle tone is that resting tension or tone in our muscles when we're not doing anything. And there is an average range for where that should be. Well, kids with low muscle tone don't have as much tension in their muscles, so their muscles often feel floppy and mushy. And in terms of function, this means that it takes a lot more energy and a lot more work to get those muscles to do what you want them to do. So, as a PT, it's my job to start really early on, helping kids with Down syndrome activate those muscles and get them stronger. And this strength is what they need to hit all those motor milestones. Whether it's sitting, crawling, walking, running, or climbing the stairs, they need the right amount of strength in order to do that. Along with strength, we work on things like balance, coordination, and all those skills necessary so that children with Down syndrome can move throughout their environment in any way they want. If they want to go to the park with their friends, they can do it. If they want to get up the stairs on the bus by themselves, they can do that. So the goal is to give them enough strength and the skills they need to access the world in any way they want. So children with Down syndrome can also benefit from other therapies, things like occupational therapy that help work on their fine motor skills and their self-care skills. So writing, coloring, stringing beads, brushing their hair, brushing their teeth, zipping their pants, and buttoning buttons. They can also benefit from speech and language therapy. So often we think of SLPs as communication experts, which they absolutely are, helping children use their mouth and their voice to communicate, but they can also help with important skills like feeding. So muscles around the mouth can have low tone and not work as well as they should, just like the quadriceps and the biceps. So SLPs tend to be experts in the area of feeding and swallowing and helping kids with Down syndrome in that area. As a PT, I of course believe in the importance of direct therapy services. I mean, it's what my whole life has been about. But I also think it's really important for us to think about getting kids with Down syndrome involved in movement activities outside of therapy. Now, a lot of them have access to great activities at school, but I think there's also a lot available out in the community. Now, an organization that I've had lots of kids participate in over the years is the Special Olympics, and I will leave a link to their website in the description box below. But depending on where you live, there's different sports and activities available for kids of all ability levels. And if you look within your community, you might be surprised at what you find. Down here where I live, we have adapted baseball, we have adapted soccer, and we even have adapted surfing that's available for kids with special needs. So there's lots of great opportunities out there to get kids moving and to create this system of lifelong activity and lifelong movement. Well, I hope you guys learned a little something new about Down syndrome today, and I will be sure to leave links to all the things I talked about today in the description box below and any other resources that I can find. If you'd like any more information, don't forget to pop over to my website, pediatrictherapyessentials.com, and check out the blog post that goes along with today's video. Well, I hope each and every one of you has a wonderful week, and I will look forward to seeing you next Saturday. Bye!